which pieces of information we wanted to provide and which to leave out. So to make sure that I keep this within an hour, I might go a little fast, but these slides will be available on my website at the end of this presentation. So we're going to just dive right in. So first, we're going to talk about the disparities regarding the Trump administration. So the Trump administration has revoked key public health data from federal agency websites, which includes the CDC and the FDA pages on racial disparities, HIV prevalence, and clinical trial diversities. So executive orders have eliminated references to racial equity, gender identity, and DEI programs from government materials. So the legal challenges have been filed, arguing that these removals hinder research and healthcare efforts, especially for marginalized communities and BIPOC communities. Experts warn that restricting access to this health data will worsen disparities, but the Trump administration, of course, appears indifferent to those arguments. So we all know that for too long, Black, Indigenous, and people of color, BIPOC communities have been left behind, intentionally harmed by our policy and systematic racism. In order for us to move forward, we must understand the current state and landscape of where things are right now. So that's exactly what this presentation is designed to do, is to provide you with the information and the tools that you need in order to take this information and move forward, use it in research, or just to have the knowledge for a better understanding of why our community looks the way that it is. Now, most of the information that you'll be hearing in this PowerPoint is going to center around social determinants of health. Basically, social determinants of health is anything that's non-medical that affects your life and your longevity. So it can be your community in which you live, your environment, your income, your job. All of those things are social determinants of health that help to determine circumstances surrounding your environment. So we're going to talk about housing insecurity first. So on any given day in 2024, Wisconsin had over 5,000 individuals sleeping in places not meant for human habitation. And that was up from 4,861 people in 2023. So that could be people sleeping in tents, out on the streets, any place that's not meant for individuals to actually dwell. In 2022-23, 18,455 children attending Wisconsin public schools lacked a fixed and regular and adequate nighttime residence for sleeping. Wisconsin's housing shortage disproportionately impacts the lowest income households. In 2023, Milwaukee alone needed 72,000 housing units for people making just under $15 per hour who were spending more than 30% of their income on housing. Wisconsin as a whole had an estimated 188,000 households earning less than 30% of the median income, with only 69,000 homes considered affordable for families. Now, Black Wisconsinites are 11 times as likely to experience homelessness than their white counterparts. According to the 2021 point in time count, 58% of homeless Milwaukeeans are Black, despite African Americans making up just 38.6% of the city's total population. In contrast, 36.9% of homeless people in Milwaukee are white. Yet white Americans account for 44.4% of the city's entire population in the city of Milwaukee. Poverty among Milwaukee's African American children is 38.8%, which is the third worst out of the 50 largest metropolitan areas. African American home ownership in Milwaukee is just 27.5%. Ranking us next to last out of the 50 largest metropolitan areas. Now, this disparity ranks Milwaukee 48th in Black, white, non-Hispanic home ownership. According to WIDA, the state needs around 30,000 more African American homeowners in order to close this racial divide. The median household income for African Americans living in the city of Milwaukee in 2022 was just $37,182. This income ranks Milwaukee 50th out of the 50 largest metropolitan cities. That means that we are dead last in terms of median incomes for African Americans. Just 13.4% of African Americans living in the city of Milwaukee in 2022 earned over $100,000, which is the lowest percentage out of the 50 largest metropolitan areas. Milwaukee's African American poverty rate is 30.1%, which is the worst out of the largest metropolitan cities, creating the widest margin gap among Black, white, non-Hispanic poverty disparity. Now, this next slide concentrates a little bit on where we currently are right now in the Department of Corrections. So there are currently 37 facilities that make up the Department of Corrections. The Department of Corrections population and their budget is exceptionally high. And this is due in large part to the number of inmates we incarcerate yearly through the Department of Corrections and their adult prison system. Our adult prison systems were designed to only hold 17,631 inmates. However, as of February 14, 2025, the Wisconsin Department of Corrections reported an adult inmate capacity of 23,062 inmates. These individuals are incarcerated at a cost of between $44,000 and $55,000 per year. Now, 95% of those individuals incarcerated will return to their community within 5 years. Approximately 7,000 inmates are released from the prison system and return to their communities every single year. On March 24, 2023, former DOC Secretary Kevin Carr stated that there were approximately 6,600 inmates incarcerated for non-statutorily violent crimes that could be better and more beneficially served in their community at $4,400 per year versus the $44,000 to $55,000 per year mark. Republicans said releasing these inmates were a non-starter. Now, what we mean by non-statutorily violent crime, it means that by state standards, the crimes that were committed are not violent. So these are not violent offenders. But we also have to remember that if the prisons are only designed to hold 17,000 people roughly, and we have 23,000 people that are currently being held, that there is a serious overcrowding problem. Now, during the same time period, the prisons were averaging a 33% employment vacancy rate. So I know some of you have heard that in some of the prisons, some of the inmates were only allowed out once a week for a shower. That's because they did not have enough employees to monitor all of the inmates that were housed there. Now, Kettle Moraine and Waupun were exceptions. They averaged vacancy rates of 50%, which means that half of their staff positions were vacant. And drastic, if we don't put in place drastic prison reforms, if we don't do something to curb this population, is expected to exceed 24,000 by the end of the 2025-2027 budget. So we're going to have to do something because there's no way that we can continuously house these inmates at the rates that we are. Now, for community supervision, as of November 30th, 2024, we have 40,775 on probation, 22,218 on parole, for a total of 63,000 individuals in the state of Wisconsin that are on either probation or parole, also known as community supervision. Per a study by the University of Wisconsin-Madison, African American males are incarcerated 14 times the rate of white males. 42% of men incarcerated in adult prison have an undiagnosed mental health illness. 90% of the females incarcerated in our adult prison system have an undiagnosed mental health condition, with 29% having a serious mental health need. Now we'll talk about personal safety. In 2022, Wisconsin experienced 830 gun-related deaths, comprising of 529 suicides, 277 homicides. Now, gun homicides, assaults, and shootings by police cost Wisconsin $9 billion each year, amounting to more than $1,500 per person in this state. We'll talk about Milwaukee Police Department data going forward. So in 2023, Milwaukee police confiscated 3,297 guns, of which 2,843 of those guns were used as evidence guns. In 2024, Milwaukee reported 132 homicides, which is a 23% decrease from 172 in 2023. Now, this indicates a positive downward trend. In 2024, Milwaukee also reported 639 non-fatal shootings, a 24% decrease from the previous year of 837. Black residents comprise 6.3% of Wisconsin's population, but accounted for 75.5% of firearm homicide victims in 2022. The rate of gun deaths in Wisconsin increased by 54% from 2014 to 2023, compared to 34% nationwide. Now we'll talk about shot spotter activations. Shot spotter activations are put in areas that are not commonly known to have neighbors or individuals report gunshots. It is a system in Milwaukee, and police can respond to those shot spotter activations within a matter of seconds. In some cases, they've came as early to intervene in the shooting taking place. The systems are designed to distinguish between actual gunshots and fireworks. So what we see is a downward trend for the northern boundaries. 10,527 shots versus 14,617 in 2022, and 1,117 south side boundary shots compared to 1,519 in 2022. So you can see that there is a significant difference between the number of north side shot spot activations and our south side boundaries. Now, that could be for various reasons too. It could be not a lot of shot spotter activation sites on the south side versus the north side, but that is something that's concerning. Fatal injuries, when we talk about crash data, 66 fatal injuries in 2024 opposed to 74 in 2023, so that's an 11% decline. 5,411 hit and run crashes compared to 5,409. So total for all crashes, we're looking at roughly 14,000 crashes for the year of 2024. Now, May 1st, 2022 through December 31st, 2024, reckless driving tows were 582. Unregistered tows were 573, with repeat tows just at 9. Now, if we look at January 1st through December 31st, 2024 for reckless driving tows, again, we'll see unregistered tows, 124, repeat tows, 8. So we're not seeing a lot of repeat tows. But in 2024, what we did see were 734 arrests. And there were 12,543 citation issued for reckless driving with speeding. So let's talk about some of the things that Governor Evers put in his proposed budget for 25-27 to help deal with some of these issues that we're seeing in terms of public safety. For example, Governor Evers put in his budget, raise the age for adult corrections from 17 to 18. Right now, currently in the state of Wisconsin, if someone 17 years old commits a crime, they are automatically charged as an adult. We want to waive those individuals back into juvenile. Expand the earned release program to include educational, vocational, and treatment programs, as well as create a residential partnering earned release program. He also wants to increase alternatives to revocation funding with over $2.9 million in fiscal year 2025-26 and $5.9 million in fiscal year 26-27 to expand community-based options. A plan to close Wisconsin's second oldest prison, Green Bay Correctional Institution, and expand Mendota Juvenile Treatment Center in Madison, and open a new Type 1, which is a maximum secure juvenile detention facility in Milwaukee, will allow the closure of Lincoln Hills and Copper Lake schools. This state only maximum Lincoln Hills and Copper Lake is this state's only maximum secure juvenile detention center. Now, what will happen once that detention center is closed? It will reopen, and I'm talking about Lincoln Hills and Copper Lake, as a 500-bed adult correctional facility to help alleviate some of the prison overcrowding. Now, Governor Evers also proposed a second Type 1 juvenile facility will be proposed for Dane County and a third for northern Wisconsin. Now, if your child is sitting in a seat at Milwaukee Public Schools or any of the top 10 school districts, your child is worth about $13,000 in that classroom seat. But if your child is sent to Lincoln Hills or Copper Lake, our maximum secure juvenile detention center, that child is worth $460,000 per year per child. Milwaukee County pays roughly $420,000 per year per child for Lincoln Hills and Copper Lake. Now, I don't think that I need to tell anybody on this Zoom that there is something wrong with that equation. Now, if the new budget comes out and the proposed Department of Correction budget goes through, the amount for our maximum secure detention center will go up for our juveniles to $800,000 per year, $2,305 a day. And that's for one child. And that will take effect in July 2025. So those numbers are ridiculous, especially when we know that it costs more to rehabilitate a kid than to just get the situation correct the first time. So moving on, funding community reentry centers with $4 million over the biennium to help formerly incarcerated individuals reintegrate into society. So if there's one thing that I suggest that people watch during this budget, it would be the criminal justice piece. We want to make sure that we're doing right by our kids, but our kids' programming is important because we want those kids to be rehabilitated. But I think anyone would agree that we would rather spend our $800,000 on our kids on the front end than trying to rehabilitate them through incarceration. So $43 million allocated for civil legal assistance grant programs, providing legal aid for eviction prevention, unemployment claims, consumer protection, domestic violence survivors, and health insurance issues. Governor Evers is also proposing $13.4 million over the biennium for after-school programming, expanding literacy and math programs for low-income students. He's also emphasizing universal background checks for firearm sales, $3.5 million in fiscal year 2025-26, and $8.5 million in fiscal year 2026-27 to the newly created Wisconsin Office of Violence Prevention, supporting community violence intervention programs. And last but not least, $60 million for traffic calming grants. Now, one thing that I want to share with you is that Milwaukee Senate districts, both the 4th and the 6th Senate districts combined, represent two predominantly African American Senate districts. Those two districts are where the majority of African Americans live, which represent the north sides of Milwaukee. Now, what we've seen is that the north side of Milwaukee is having a mass exodus compared to other Senate districts in both the city and the county of Milwaukee. So District 4, which is represented by Senator Dora Drake, lost a total of 15,389 residents. Myself, in the 6th Senate District, I lost a total of 16,528 residents for a total of 31,917 individuals that moved from those two districts. The one thing that we know is that they're not moving from my district and moving into Dora's district because these numbers we will wash each other out. These individuals are moving all together out of both of our districts. Now, some of the people that I've spoke to that have moved, they're moving to Germantown, Mequon, to the suburbs, St. Francis. Some are just moving to the south side. But some of the reasons that I've been told for their moves were a lot of our elderly residents are saying that they're too old to deal with the reckless driving. It used to be that if you could get home before dark, you were okay. Now it's not okay for them to go to doctor's appointments during the daytime. Some people are saying that they're just tired of the crime and the gun violence, and they're just choosing to move. Now, in 2023, there were 59,739 births in Wisconsin. Of those, 5,586 were African American births. 16.8% of African American babies were born with low birth weights compared to just 7.9% statewide. This means African American babies resulted in double the number of low birth weights as the rest of the state. Now, in 2023, we also had 80 African American infant deaths, which was 14.3 deaths per 1,000 births, compared to 5.7 deaths per 1,000 births for the entire state. So that's significant. That's almost 3 times the amount of the rest of the state. Wisconsin ranks as one of the highest Black infant mortality rates in the nation. Black babies in Wisconsin are 3 times as likely to die before their first birthday compared to white babies. Specifically, the infant mortality rate in Wisconsin is 15 deaths per 1,000 live births for babies compared to just 5 deaths per 1,000 live births for white babies. Now, if you live in zip codes 53206, that the death rates go up significantly. That's about 29 deaths per 1,000 live births. The alarming numbers of infant mortality makes Wisconsin the highest of any state in the nation, at 30% above the nationwide average of 10.5 deaths per 1,000 live births, based on the 2018 CDC data. Now, Black mothers experience 1.75 times the risk of significant complications from labor or delivery facing white mothers, and 5 times the risk of dying in childbirth from complications, according to the Wisconsin Paternal Review Team. African American women represent 21% of pregnancy-related deaths. So some of the things that Governor Evers is proposing in the 2025-27 state budget to combat some of our postpartum infant mortality for African American women is to cover postpartum badger care coverage for new moms for up to 12 months. Currently, that coverage only lasts for new moms up to 60 days, and we know that that's not enough time. $55 million allocated to Healthy Moms and Healthy Babies initiative, which includes funding for maternal and child health grants, diaper banks, postpartum home visits, and increased Medicaid reimbursements for we all know what that word is, services. So I'll just leave that there. Funding for lead poisoning prevention with $6.2 million over the biennium to local health departments for lead hazard investigations and support services for children exposed to lead. Wisconsin paid family medical leave program requiring employers with 50 employees to provide at least 8 weeks of paid leave. Now, one of the things that we're going to talk about now is disparities in health in leads. So we know lead pipes like the ones in Flint, Michigan, threaten 70,000 residents in the city of Milwaukee alone, 10,000 in Racine, 8,000 in West Allis, 6,500 in Manitowoc, and the children in Milwaukee are 5.5% more likely have a greater incident of lead poisoning than those in Flint, than the children in Flint. At the peak, their crisis was only at 4.9%. Milwaukee's neighborhoods on the north and south sides disproportionately affect African Americans and Hispanics by childhood lead poisoning. Lack of investment in impoverished areas, segregation, and many other factors force communities of colors into certain communities with distressed housing. Now, according to the Wisconsin's 2022 death records, African Americans were 2.73 times more likely to die from diabetes than their white residents. African Americans had 47.7 deaths per 1,000 in 2022 compared to just 17.5 deaths per 1,000 for whites. So you can see that that number is significant. In 2022, strokes resulted in 66.9 deaths per 100,000 for African Americans, which were double the rate of strokes in whites. Heart disease in African Americans resulted in 249 deaths per 100,000 and just 164.6 deaths for whites. African Americans died at a rate of 1.5 times the rate of whites from heart disease. Black Wisconsinites had 1.4 times the risk of asthma diagnosis compared to white residents, and African American children were twice as likely to have asthma as whites. Also, African Americans are 1.26 times more likely to be diagnosed with kidney disease. So now we're going to talk about disparities in health and life expectancy. Wisconsin state records indicate that white residents live on average of 15 years longer than Black residents. White residents live on average to age 76, as to where Black residents live on average to age 61. And as you can see, for all races, the total average is about 75 years old. So in 2023, we're moving on to talk about our sexual health. In 2023, there were 24,992 cases of chlamydia reported, which accounted for 74% of sexually transmitted infections in Wisconsin. Of those, 1,021 per 100,000 cases were African American adolescents between the ages of 15 and 19, or 4.8%. There were 7,005 cases of gonorrhea, which accounted for 21% of the state's STIs, with 810 per 100,000 for ages 15-19 for African Americans at 16.7%. 5% of syphilis cases were also reported. African American adolescents had the highest rate of chlamydia, gonorrhea, syphilis at 6.7 times higher than the rate among white individuals. In 2020, racial and ethnic minorities made up just 19% of Wisconsin's population, but accounted for 61% of HIV diagnoses. Now we are going to talk about opportunities for school funding. So nearly 90% of Wisconsin African American population live in the following 6 counties: Milwaukee, Dane, Racine, Kenosha, and Waukesha, with Milwaukee topping the list with 38.6%. Now this is important because in my personal opinion, if we really wanted to change the trajectory for African Americans in this state, all you have to do is focus resources on these 6 counties because we know that 90% of the Black people living in the state of Wisconsin come from these 6 counties. And if we really focused a lot of our resources on the city of Milwaukee and just really just put the resources where they were needed, we could decrease these disparities at least by 38.6% of the population. In Wisconsin, while 1% of Wisconsin white children live in poverty areas, 35% of African American children and 18% of Latino children do. Now, Black children make up 9% of the total Wisconsin public school students. Hispanic students is approximately 13%. 43.7% of Wisconsin public school students are economically disadvantaged, but at MPS, it's 86.5% that are economically disadvantaged. Now, 1 in 10 children in Wisconsin live in poverty, while 3 in 10 African American children live in poverty in Milwaukee. African American children make up 10% of Wisconsin's population. A stunning 22.5% of African American youth ages 16 to 24 living in Milwaukee were not in school and did not have employment, resulting in us being ranked the 3rd worst in the nation. I'll repeat that again. Our children comprise 10% of the population, but a stunning 22.5% of children ages 16 to 24 were not in school and did not have employment, and that makes us the 3rd worst in the nation. Graduation rates for white students was 92.7% compared to the graduation rate of 71% for Black students. The gap in graduation rates for white and Black students is the largest in the country. Wisconsin also had 47th highest gap between Black-white students in its share of adults with either a high school or a bachelor's degree. Now, Governor Evers is proposing $3.1 billion increase in general and categorical aids for K-12 schools, the largest proposed investment in Wisconsin's history. Expanding Bucky's promise so Wisconsin household incomes of less than $62,000 can attend any UW school tuition free. Now, this is my absolute most favorite proposal because if we can allow low-income kids to go to school for free, that is a game changer, especially for BIPOC communities. We are lacking all of these things: psychiatrists, social workers, nurses, doctors. This is the key to ensuring that we can continue to fill those career pipelines without costing a lot of student loan debt to our kids that they will not be able to pay, or it'll cost them long term. The next category is $147 million to fully fund school breakfast and lunches for all children, and more than $1.1 billion in special education aid, increasing state reimbursement rates to 60% in both years. Now, Governor Evers is also proposing $10 million in fiscal year 2024-25 for the Milwaukee Math Partnership to improve math proficiency and professional development for current and raising and aspiring Milwaukee teachers. $6 million over the biennium to improve access to driver's education for low-income students. $26.7 million annually for new aid for English language acquisition programs, expanding support for more than 50,000 English learners statewide, and expansion in the state tuition eligibility for undocumented Wisconsin high school graduates, ensuring broader access to higher education. Next, we will talk about mental health. So in 2023, 14.16% of Wisconsin youths ages 12 to 17 reported a major depressive episode in the past year, with 1 in 10 attempting suicide in the past 3 years. Black youth in Wisconsin are 15 times more likely to be placed in a youth facility compared to white counterparts. Black residents in Wisconsin are approximately 23.9% more likely to be hospitalized due to self-harm, injuries compared to white residents. Now, what we also know is that the state of Wisconsin does not have residential treatment centers for children experiencing psychosis. Psychosis are severe psychiatric challenges. We know that there are over 100 children that are in children's hospital right now as we speak. The parents have signed over custody because, not because they're bad parents, but simply because they cannot access the resources that they need to keep those children safely in the home. So this legislative session, that is one of the things that we will be working on, which is trying to create a residential treatment facilities for these children. In the past, we have sent them out of state to Minnesota, to Tennessee. Unfortunately, those states are having to deal with their own children, and we shouldn't have to send our children out of state for the help and the resources that they need. They should be able to access those resources right here in Wisconsin, close to home, and we should be able to keep our families together rather than forcing parents to make those just, I can't even unimaginable decisions to sign their kids' custody over because they cannot access some help. And these are children that cannot go into regular foster care because the services in those homes would not be adequate. They need intensive, severe help for psychosis. Now, what Governor Evers is proposing to do for mental health is $300 million investment in school-based mental health services, the highest biannual investment ever. $83.9 million annually to fund per pupil payments for comprehensive school-based mental health programs. $7.6 million over 2 years to support regional crisis stabilization facilities, providing short-term care for adults in crisis. $20 million allocated to establish crisis urgent cares and observation centers reducing emergency detention cases, and $4.2 million for the 988 Suicide and Crisis Lifeline, supporting call centers and meeting rising demand. $1.8 million to establish psychiatric residential treatment facilities, expanding psychiatric care for youth under the age of 21, which was the residential treatment centers that I was talking about earlier. So with that being said, there are some people that I really, really want to thank that helped me to pull this off. I'd like to thank the Department of Human Services, the Department of Children and Families, the Legislative Physical Bureau, Mark Levine from the University of Wisconsin-Madison. If there's anything that you want to know further or any details that you are concerned about or you need clarity on, feel free to reach out to our office with questions. As I said earlier, this PowerPoint will be available on our website. And thank you so very much for tuning in for the State of Black Wisconsin. I hope this information was helpful, and I hope with the information that we've gained that we can continue to move the state forward. I want to say one more thing in closing, though. Our African American children are in a state of crisis, and we know this. But there are certain things that we all can do to make sure that our children are okay. If there is a single mom in your neighborhood or kids that, might be having a tough time, help that family out. Every little bit helps. If you're making dinner and you have an extra chicken wing, feed that child. Feed that family. If you have an extra couple of dollars and you notice that there's a kid in your neighborhood that doesn't have a winter coat, buy them one on clearance. It is going to take all hands on deck to make sure that our kids are healthy, whole, and they get the education, the love, the protection, and the environments that they deserve. We can't depend on the state or any other government entity to do these things for us. We can see that. We can see from these disparities that some of these disparities are not improving, they are getting worse. So we need to do our part to make sure that our communities continue to stay intact, that our children can continue to stay in their homes, and that everybody does their part to make sure that we can keep our families together. So thank you for tuning in, and you have a wonderful day.